Today I want to talk with you about a condition that might be affecting your baby if they have been diagnosed with hypoxic ischemic encephalopathy or HIE at birth. And that condition is called hypertonia. If you're hearing this term for the first time, you're not alone. So let's break down what is hypertonia and how it can be connected in some instances to HIE and what this might mean for your baby as they get older. So first, what is hypertonia? Hypertonia refers to increased muscle tone, meaning that your baby's muscles, they may feel unusually stiff or rigid. You might notice that their arms and legs feel tense and difficult to move. They may struggle with basic movements like reaching for objects or holding their head up. This stiffness happens because the muscles are contracted more than they should be, which can make everyday movements, can make that harder for your baby. Now, let's look at hypertonia and how it can be linked in some instances to HIE. HIE occurs when the baby's brain does not receive enough oxygen during labor and delivery in our context. This lack of oxygen can cause damage to areas of the brain that are responsible for controlling muscle tone and movement, specifically damage to the regions like the motor cortex or the basal ganglia, parts of the brain that regulate muscle control. And this can lead to hypertonia. As a result, your baby may develop these types of increased muscle stiffness as one of the long-term effects of the brain injury, of this HIE injury. Now, however, it is important to know that hypertonia isn't always connected to HIE. While hypertonia can be a result of a brain injury from HIE, it can also develop due to other types of neurological conditions. Genetic disorders, they can also play a role in this. So every case is unique and not all babies with HIE will have hypertonia. That's just something that you have to understand. Your doctor will work with you to identify the specific causes and work to develop a plan for your baby and their treatment and care. So what early signs should you be on the lookout for? You might notice that your baby seems stiff, especially in the arms or the legs. They may also have trouble moving certain body parts, or they may show delays in reaching certain types of developmental milestones like sitting up or rolling over. Feeding difficulties, they can also show up with this. Trouble grasping for objects or generally a rigid posture. All of these types of things can be early indications of hypertonia. If you see signs like this, make sure that you talk with your doctor. The medical team, often including a neurologist and a physical therapist, they can assess and confirm whether hypertonia is present. And early diagnosis is key to managing this condition. So now let's talk about treatment options for it. While there is no cure for hypertonia, there are ways to work to try to manage it to improve your baby's quality of life. Physical therapy, that's one of the most common treatments for it. And the reason why is because it focuses on stretching muscles and movements and to help reduce the muscle stiffness and improve your baby's range of motion. In some cases, medications, they may also be recommended to help relax your baby's muscles. Occupational therapy can also work to help with your baby's fine motor skills, to improve their ability to interact with their environment. Every baby is different, and the treatment plan will depend specifically on your baby's needs. The earlier that the treatment can begin with something like this, the better chance that you have for making progress. I'm Marcus Boston, and I'm a birth injury lawyer. If you have questions about your baby's HIE brain injury from a medical legal standpoint, don't hesitate to contact me. You can find more information about me in my profile. You can find my contact details and all that type of information in my profile. All right, that's going to be it for today's quick educational video. All right, everybody have a great weekend.